Hello, everyone, and welcome back to CCA's Medical Minute. My name is Steve Abbott. I'm Executive Director of Cincinnati Cancer Advisors. Our podcast is brought to you today by Kroger Health, and I'm here with my co-host, Sherry Hughes, our Director of Strategic Community Engagement.
Hi, Steve.
How are you, Sherry?
I'm good.
Thank you for being at your desk 3 minutes ago when I came and got you and said we had an emergency and we
Hey,
needed
I'm
you on the
I'm
podcast.
always here for you.
All
You know that, right?
right. One of our doctors was going to be on today, and he's currently with a patient, and we always prioritize patient care here at Cincinnati Cancer Advisors. So we're going to roll with it. Happy to have as our guest today John and Liza Marshall. We'll talk a little bit more about their book called Off Our Chest.
Yeah, and
Yeah,
and you
that's
know
right, Off
what?
Our
I've
Chest.
been reading it, and
Yeah.
really, Dr. John has a
Yeah.
lot to get off his chest.
All right, all right. I have a little bit of insight into that from what little bit I've had a chance to. So it's funny. Dr. Jazzy brought us both these books, almost 300-page books, like 2 or 3 days ago, and then when we had knew we were on having you on today, I'm like, I can read pretty fast, but not that fast. So we'll be coming along behind you guys with detailed information out of your book, um, but anyway, just so great to have you guys here today. If you hear a thumping sound during the podcast, Chris has been here working on video projects since 6 a.m. So that sound could be his head hitting the desk. So I hope not. But anyway, John and Liza, welcome to the podcast today. And what we really pride ourselves here on this podcast is being able to distill complicated information for cancer patients. You know, Dr. John, I don't know how you feel about and how you approach patients, but we find oftentimes patients don't really even understand what they're being told. So we really appreciate Liza's work as kind of on the advocacy side, and for also writing this book, which is really important for patients on their journey. So anyway, to kick things off, Liza, can you? I am the proud husband of a triple negative breast cancer survivor myself. In fact, she was with us this morning, but had to go home and take care of some things. So otherwise, she might be sitting with us as well. But if you could tell us a little bit, I think you were actually relatively young when you were diagnosed. If you could give us a little bit of information about that, your prognosis at the time, and that'll kind of take us into, I think, your treatment journey and your cancer journey so far.
Sure, I'll start with the first part of that anyway, and you can guide as you would like. Thank you all for having us on. Well, we really appreciate it. We're excited to talk with you all, and I think meet you all in a few weeks too. So, and also congratulations to your wife. That is, as she and I both appreciate, whether it's an accomplishment or good luck, we appreciate it. So, yeah, I was diagnosed in 2006 at the age of 43, and we as with pretty much everybody who gets a cancer diagnosis, it was a complete shock. I was not expecting it. I'd had some breast changes, but really in the other breast, and then had this swollen breast. And so I went and had a biopsy and really forgot about it. And weirdly, John actually accidentally was copied on the pathology report. And so I actually found out from him in a casual phone call, family phone, just logistics for the week, that I had breast cancer. And we very quickly, because John worked in a cancer center, and because of what had happened, this accidental, I think, passing of the report to John, we very quickly moved to MRI that afternoon, meeting with the oncologist, who was obviously a colleague of John's. And actually, we met with two oncologists who were colleagues of John's, but one's a very good friend. So we decided that was probably not the best person to treat me. And so yeah, I guess I had surgery really about a week later. It was when they had done the biopsy, they actually had not gotten any piece of tumor. They had only gotten tumor cells in the lymph system. So they knew it was already starting to spread, and also didn't really know where it was. It wasn't really showing up on an MRI. So I went ahead and did a mastectomy, and the biopsy came back from that. The pathology came back from that it was triple negative, and that it was in a couple of lymph nodes, but not any farther than that. So I was very fortunate in that.
Well, thank you, Liza. And first of all, if I can correct you on one thing, anytime that you find out you have cancer via a phone call. It's not a casual phone call. So, it's not very casual.
It started
Um,
out that way.
yeah, that's right. So, so Dr. Marshall, if you could tell us, because you hear these terms like triple negative, and this is the kind of stuff we feast on in this podcast, which is what in the world does that mean? I mean, to people that don't know. I mean, I know it has to do, it has to do with what is
The
it?
pathology.
Yeah, the
Yeah.
pathology, and but you're
Receptors.
triple negative. What are you negative for?
So many things. No, actually, to take us to the end of this answer first, watching Liza hear these descriptions, right? Being in there in the room as a caregiver now with my colleagues, having discussions of words that I thought were very basic, fundamental words, biopsy, profile, whatever. There are just many of them. Fast forward to now that we've got a new project that we're working on with this group called One Cancer Place, where we're actually building out an annotated dictionary. So the
That is
bunch of
awesome.
words that you're going to hear for a diagnosis and what they mean in an hour-long discussion, and then your treatment and clinical trials, et cetera. So chapters with all of these words that you're referring to, so that somebody who is having this first moment can do a crash course in the language, right? Because how do you make decisions? All the decisions we push out to patients, shared decision making. How do you make those decisions when you don't even know what the words mean? Much, they sound scary for sure.
Yeah, and Dr. John, I would this is Sherry. I would imagine it's something that you probably don't think a lot of because you're the oncologist, and to have your wife diagnosed with a breast cancer, I'm sure that gave you a lot to glean into, the minds perhaps of other uh, folks that are diagnosed, women diagnosed with a breast cancer. I myself, as well, am a breast cancer survivor. I was diagnosed in 2019 with invasive ductal carcinoma. I wasn't triple negative, but HER2 positive. And so, as you said, the terminology and all the things you have to learn about cancer, it is just over mind blowing to me. I'm sure as it was to Liza as well. So, doctor, tell us, how were you able to help your wife as she's getting this news that no one wants to get, in trying to help her with a better understanding of what was actually going on?
Well, let me answer Steve's question that I dodged before. Triple negative, we measure three things on the breast cells themselves. One is estrogen receptor, one is progesterone receptor, and one is HER2. As you mentioned, yours was HER2 positive. So if all three of those are not picking up those receptor stains, then the cell doesn't have those elements to it. Why we care is that different treatments go through those different pathways, if you will. Like there's a light switch over there that turns on those lights. Which light switch is actually broken? The HER2 light switch or the ER light switch? Use different tools to different medicines, and they have different risks and the like. And Sherry, to your point, my experience now as a caregiver, being on the receiving end of all of this information, even when it was bad to know everything, honestly, because then your brain could really go to bad places pretty quickly. But as we reflect in the book, it sort of messed me up, my practice, because then I knew what it was to be told these things. And now when I was again telling my patients, and I do GI cancers, which is a pretty bad group of cancers, sharing this very challenging news to young people, more and more young people, it just took longer. I took it home with me more. I felt it more. And, we're trained for the medical people to be kind of over here and objective and, a little bit cold in some ways. But there's no way you can really be an effective oncologist and be that way. So it dragged me closer to the patient. Risk of that is you have burnout from the medical community because we're taking all of these people home with us in our hearts and our souls. So it's a big cycle of wanting to be the best doc you can be, the most compassionate doc, but then also protecting your own heart and soul from all that we do.
Yeah. With that, Dr. Marshall, with that light switch analogy, if you're ever out of work, you could probably be a podcast host on CCA's Medical Minute. We love that kind of stuff. It helps people understand things. I mean, in all seriousness, though, and on your annotated guide, I mean, that's something I could see someday us wanting to hand a patient when they're here because.
Well, what's been fun is I'm talking with this other friend, a doctor, and Liza's also on it. And she interrupts and goes, "Wait, you just used the word we don't know in the definition."
Right.
So,
Yeah.
she, having this sort of patient reality check has been very useful.
Well, and yeah, and you're exactly right. Because, in fact, I was on, we were doing video this morning and I was talking about that, words, simple things like resection instead of saying resection instead of surgery, or, refractory instead of being resistant to, the therapy. And it's sometimes you wonder, like, why can't we just say those words instead of having code words that people don't understand? So I think you're really onto something that'd be really, really, really helpful. Liza, one of the things I talked about in the video project I was involved in this morning was how a cancer diagnosis changed my life. And what I mean by that is not so much from a physical perspective, but did it result in any changes to you personally? And so we talked about that at length this morning. And I think almost every cancer patient would say yes to some degree. And I certainly had plenty to say about it. But how has that been for you? I mean, have you kind of evolved in kind of what you're doing and how you spend your time and what you value and the ways you spend your time?
Yeah, definitely. I think when we were going through it, I tried very hard not to let it change my life. And our children were 10 and 14. And so I think a lot of it was trying to maintain for them that, everything, I mean, we talked to them about it and they knew a lot, but still we wanted life to be normal for them and not feel like their whole life was revolving around their mother who had cancer. But as time has progressed, and particularly with the book, I think I've sort of maybe almost been dragged in a little bit in a way that, I mean, I've been involved with a cancer organization here since actually before I was diagnosed. But as John says, I mean, in all of these things, once you're diagnosed, your understanding of it is completely different from coming in from the outside. And so my involvement with the group has changed. And then I'm very involved with this One Cancer Place that John was mentioning and the book. And we've done a lot of talks. I mean, I joke, I now go to the big cancer conference every year, which I used to avoid at all costs because John was so busy. But now I have places to go and people to meet and things to do. So, and I love it. I mean, it's a wonderful community that does so much good work for so many people who need it.
Liza and also Dr. John, how do you feel now knowing that there is for triple negative, there's a phase 2 clinical trial that's in progress right now? I'm sure when you were diagnosed, I believe, Liza, you said 2006.
Mm-hmm.
That we were far removed from any type of a clinical trial for a vaccine. So have you heard much about that? And what are your thoughts on the fact that, the triple negative is one of the more aggressive types because of, as Dr. John said, the pathology of it, having everything be a negative component. So what are your feelings on this new vaccine that's in clinical phase 2 trial right now here in the state of Ohio, actually?
Oh, wow. Yeah, no, I had heard about it on the news recently. I mean, I don't know much about it, but I mean, the treatment possibilities, opportunities for triple negative cancer have changed so dramatically in the last, we're now to about 17 years, I guess. And, I mean, one of the things John talks about, I think he starts the book off with is his resentment and envy of the breast cancer advocacy movement and how much money they have. Up until fairly recently, breast cancer got 10 times the amount of funding as all other cancers put together. But at the same time, we both very much recognize that and laud what they have done and how much they have caused the advance of treatment of all types of breast cancer. And as John will say, I don't mean to keep quoting you, John, I should let you speak for yourself, but they they were the first ones really to look, or some of the first ones, I think, to look at that. There are 3 different kinds of breast cancer, well, more than that, I guess, depending on your combos, but which is something that other cancers are just kind of coming to. So I think the hope is that breast cancer sets that that model for everybody else. And as we get more money and more advocacy into the other cancers, they also will, their outcomes will improve and their treatments will improve.
And Liza, Sherry, let me add on to that, is that I'm an old oncologist. So I remember when being HER2 positive was just bad news and there was nothing you could do about it. But now, believe it or not, you want to be HER2 positive. That, because of the way the treatments go and our understanding of what makes those tumors tick, having that HER2 light switch and very powerful therapies that attack it. In fact, at our big cancer meeting that Liza was referring to, ASCO, the breast team, the breast researchers, figured out that some triple negative breast cancers had low levels of the light switch, low levels of HER2. And now with this new drug called Enhertu, they could target these, what formerly were untreatable with that treatment, and cause, significant benefit. To your point, we're now figuring out how the immune system, using vaccines or other ways of harnessing our own immune systems, they're not broken, to actually go and treat these cancers. And so it's true for triple negative breast cancer, but I want other cancer patients out there to recognize that we are also working on lung cancer with major positives, and kidney cancers and colon cancers and pancreas cancers, et cetera. So we're making progress across the board.
So that, in fact, it's funny. I was going to ask you to comment on immunotherapy in with use of breast cancer, because I think is it Optiva or Yervoy that I keep seeing commercials for that it looks like that's in use for. But one thing that was interesting, and you talked about the funding gap between breast cancer and other cancers, and I've actually talked about this a lot. I'm close to an 11-year advanced prostate cancer survivor, and do a lot of advocacy work around that. And part of what I spend my time trying to do is get guys off the sideline. So it's one thing you can complain about, or not complain, but you can note what a funding gap there is. But I mean, God bless the women that have stood up and done what needs to be done to raise that money, because it's harder to get guys to do it. So I mean, bravo to everybody that's been involved in it. And so I think we've got you coming to our town on March 1st. So we're going to do a program that evening, and we'll be really happy to feature you guys and talk about the book and spend a little bit more time on this. As it turns out, I'm going to be in your town from February 24th through the 28th for the Zero Prostate Cancer Summit. So I'll look you guys up and see if we can't grab a dinner or something while we're there and talk a little bit more.
Great. We would love to do that.
Yeah, that'd be great. So thanks. I mean, we've got so much more to talk about. We try to keep these to 15 minutes or so. So I think it lends itself to another time that we can do this, if you don't mind.
Yeah, and this gives everyone a chance to get this book, perhaps,
yeah.
and jump into it and kind of see what the experience was for you as a husband and wife, especially someone going through a breast cancer, and the husband's an oncologist.
Yeah,
I mean, that's far different than most other experienls, I might add.
In that setting, he's an oncologist and a translator.
Yeah,
which is important
too, right?
Well, thanks so much, John and Liza, for being on today, and we will certainly have you back. Especially, here's what I'll make you a promise: once we're actually finished reading this book, once I've had it for more than 3 days, we'll have you back and we'll talk a little bit more, if that's okay with you guys.
Sounds great. We would love to do that.
We'd love it.
All right, sounds good. Thanks so much, John and Liza Marshall. Thanks, Sherry, for being somewhere near your desk when I needed you today.
It's a pleasure to be able to talk to you, the Dr. Mrs.
There we go. All right, we're going to go. Hopefully I'll get back and actually get some other work done today, but it's been fun being on video all day long. And Chris, thanks for your efforts as well. So take care, guys. Have a good rest of the week, and I will see you soon in the DC area, and then we'll see you again here soon in Cincinnati.
Thanks. Sounds good.
Thank you all.
Take care, everybody. Thank you.
Bye.